Hey, it's Jeremiah Aha with HearYou.org. I'm a counselor here, as also assistant director. Proud to be in partnership with Brother Be Well. This video is going to cover bipolar disorders. Before we jump in, the content in this video is not intended to treat or diagnose, also doesn't give the full scope of bipolar disorders. If you or someone you know is in a medical or psychiatric emergency, you can dial 911, visit the nearest emergency room, or text HELP, H-E-L-P, to 741-741. Okay? Let's jump in. Bipolar disorders. Now, these vary in severity. So someone could be experiencing this or kind of have this condition and can have a fully functioning, meaningful life, whereas others, this could be something that could be severely debilitating for them, really having an impact on their day-to-day functioning. One of the important things to note about bipolar disorders is very, very helpful to have a medical professional involved as soon as you can. Because medication oftentimes can be helpful for individuals with bipolar disorders. And so getting them involved on the front end can be very helpful in conjunction with a mental health clinician. So what are some of the characteristics of bipolar disorder? Well, if you are familiar, maybe you remember that there's periods of excitability or manic episodes. This could look like excessive talking, very, very low sleep. I'm talking like 90 minutes a night. There is some grandiose kind of claims or some beliefs about oneself, thinking all of a sudden they can be an Olympian or they can run for office or something like this, right? Whereas this might sound maybe enjoyable or even productive to a point, I tell you it is definitely not, because many times with these manic episodes, individuals can experience or engage in activities that are dangerous, that are reckless, that are illicit to finances, to family, and to relationships. And these episodes can last 4 to 7 days or longer. And then the individual dips back into a depressive episode. So it could be weeks at a time. Then they feel like barely getting out of bed, zero motivation, a lot of sleep, kind of the direct opposite, going back and forth. And you can probably understand how challenging this might be for an individual or for their partner to live through this. It's encouraging for me to tell you that this does respond well to therapy, especially in conjunction with medication. So we advise for that to happen. All right, that should do it for this particular video. Again, my name is Jeremiah Aha with HearYou.org, reminding you to brother, be well.